To understand why we're in greater need than ever of nurses, some say the first place to look is your bill.
The way our society pays for nurses at hospitals, they're viewed more as a cost because they can't bill for their services the way physicians can. So if you look at a hospital spreadsheet, their biggest cost is nursing.
Sarah Zanton is the dean of the Johns Hopkins School of Nursing. She knows what most in medicine do. In our healthcare system, doctors produce revenue by ordering services. A surgery, an x-ray, they can bill all of it to insurance. Nurses can't.
Nurses are one of the costs, along with the Jell-O and the towels and everything else in the kind of the room charge, which doesn't make sense because they add value.
It's why she says even though numerous studies have found that more nurses on staff leads to better outcomes for patients, nurses are often furloughed or let go when hospitals need to cut costs. And that's why, among other reasons, our country is facing an estimated shortage of more than 200,000 nurses.
COVID has exacerbated the nursing shortage, but it was around before COVID.
Pre-COVID, roughly 1 in 10 hospitals reported high vacancy rates among nurses. Last year, it was 3 in 5. 3 in 5 nurses say they're asked to cover additional shifts and work beyond their typical shift at least once a week. What do they say they want most? More support and more money.
In times of need for a great national interest, we tend to look to the government, right?
Zanton recently spoke in front of Congress. She says the government can make the biggest difference just by giving extra funding to hospitals, scholarships, and instructors.
About 90,000 applications are rejected across the country that are well qualified to be nurses that nursing schools can't take in because of lack of nursing faculty.
We've produced plenty of nurses. We're not retaining them.
Rebecca Love is the Chief Clinical Officer at IntelliCare. They're among a wave of companies looking to make life more flexible for nurses, in their case, through an Uber-style app for shifts. The pandemic saw more nurses get paid to travel and work part-time at higher rates.
We're investing in billions of technology to help surgeons do better surgery, but we've never really looked at investing in technology that works better for the nurse.
This is the time to figure it out. People are living longer. The over 65 population will balloon in the coming years. We've done many stories on hospitals closing, doctors leaving, and healthcare as a whole teetering. Nurses are at the center, even if they're typically not on the bill.
Healthcare cannot exist without nurses. Hospitals cannot stay open without nurses. We know that because if they could, they would just send patients to hotels.
I'm Matt Pearl.